The next tray that we have is the crown and bridge tray. A crown is a tooth over top of your existing tooth. It's a fake tooth, otherwise known as like a cap. Some patients call it that. So this is if somebody comes in, they have a broken tooth, and it's more than half gone. We need to put something over top of it to keep it strong. So the first step is going to be the Mirror and Explore, like every other tray. And then in most cases, you will go through anesthetic. So you'll need the topical anesthetic as well as the aspirating syringes. There is a side note on this. If somebody has already had a root canal, then they are required to get a crown then on top of that tooth. So if the nerve is gone in the tooth by getting a root canal, then they can't feel anything on the tooth. But you'll see in a moment, we are actually kind of messing around on the gum tissue, so they might want to be numb. So otherwise it might be uncomfortable. So either they're going to use anesthetic or they're not. Then they're going to go through the high-speed handpiece and slow-speed handpiece. They're going to be essentially taking that tooth down into a peg, so because something has to fit over top of it. So they're going to use the high-speed and slow-speed. You will have the HVE at that time. Then the next step is we need to actually pat cord around the tooth. So we're going to use the cotton pliers and cord. You can see it here. This is what's going to be shoved down between the teeth and the gums. We want to separate the gum tissue from the tooth because we want to have an impression go underneath the gums. We want to have an impression material go there. And the reason for that is because we don't want to make a fake tooth that sits above the gum line. You don't want tooth exposed. That would be susceptible to getting a cavity. So you pass the cord, and then you need to pass the dentist the cord packer, which is really the only instrument on here. And you'll notice it kind of looks like a hatchet, but if you look really close, you see how it's bent, it's curved just a little bit. So it's a little different than a hatchet, but it looks similar. Again, that hatchet was on that amalgam tray. So you pass the cord and then the cord packer, and then we're going to give the dentist a cotton roll. They're going to place that in the patient's mouth. They're going to gently bite down on that for about 10 minutes. And that's just allowing the blood to stop around the gum tissue and allowing the gum tissue to kind of be pushed back away from the tooth. So 10 minutes later, you come back, you remove the cotton roll. You could give the dentist back the cotton pliers. They will remove the cord from around the gum tissue. And then the next step is we're going to take an impression. Now, the assistant is going to fill up the impression tray called a triple tray. That is disposable. They're going to fill it up with the Koch-style gun, and they'll have a tip on the end that's a little bit different than the doctor's. So that's the Koch-style gun. This is different impression material. This is not alginate. This is about an $8 to $10 impression. So the assistant will put that tip on there and load it up into the impression tray, while the doctor is using usually the same thing. It's usually a Koch-style gun, but the tip is different. You see how it's angled a little bit different? So in that case, that's why we're showing you this one. The dentist would use that, and where we just had that cord where it has separated the gum tissue from the tooth, that impression material the dentist places is going to be shoved in between the tooth and the gums. So the dentist uses that while you fill the impression tray, and then the patient's going to bite down on it. This is different than like an alginate impression because it's going to show us both arches. It'll give us the opposing arch. Obviously that's needed because the lab, a dental lab technician is who's going to make that crown, and they need to know where the opposing tooth is. Once that impression is taken, then we need to make a temporary crown. Temporary crowns can be made a few different ways, but the temporaries are made in the office. We have a few different examples here. They are made out of acrylic, and the dentist will make it. Sometimes the assistants make it. The one on the very top there is actually a temporary bridge. The other two are just temporary crowns. So a temporary crown is made. It's not going to look as nice as a permanent crown, but we will make it look as good as possible. We will cement that in with a temporary cement such as Provisa. On a side note, you obviously do need to make sure that it fits okay. So you see the articulating paper holder is on the tray. We do need to make any adjustments on it. We don't want the patient to bite down too hard on a temporary. At this visit, we also want to make sure if we're doing a porcelain crown that we know the shade of the tooth. Everybody's teeth are different shades and colors, so we will use a shade guide, and then what we do is we handwrite out a prescription to the lab telling them what we want them to make, and so we would put the shade on there as well. There's gold crowns and there's porcelain crowns, so it just kind of depends on what you want. A permanent crown, when it comes back, are going to be those ones that are porcelain. And there's a permanent bridge, and then there's a permanent crown. Obviously, those look way nicer than the temporaries. When the patient comes back for that, then that's going to be tried in. Articulating paper is used, and when it's all good, we're going to use a permanent cement such as Ketac or Duralon or zinc phosphate. Now, the only difference between the Crown and Bridge 1, 2, and 3 is that we are going to do it as an actual bridge. So when you're doing a bridge, that means you have more than one crown. So we have a fake tooth called an abutment, and we have the anchor teeth called abutments. The pontic, I said that wrong, excuse me. The pontic is the missing tooth. The abutments are on the side. They're the anchor teeth. And so you would need 2 cords. If you have 2 abutments, you need 2 cords. So you hand the cord packer, and then cord packer, and it's all the same, except that you make a temporary bridge and make a permanent bridge. That's it.